The last 2 years have been times of absolutely tremendous change in healthcare and in the health IT industry. The first major change was the passage of the HITECH Act, a part of the economic stimulus legislation that happened in February 2009. The second, just a year later, was the passage of the healthcare reform law. Whether you are excited or skeptical about these two pieces of legislation, or perhaps both, it is simply a fact that healthcare is undergoing fundamental change, and it will never be the same again. These changes at the federal level have affected and will continue to affect every one of you in the healthcare industry and indeed the entire community. Meaningful use and EHR incentives have certainly accelerated the adoption of both electronic health records and health information exchange. Our estimate, we think it's a conservative estimate, is that incentive funds could bring in as much as $200 million across the tri-state region. The Patient Protection and Affordable Care Act also promises to bring new opportunities and changes, particularly as accountable care and payment reform provisions in the law change how healthcare is financed. It's been our goal at HealthBridge to help our community and our customers navigate these changes successfully. Part of our strategy for accomplishing this goal was looking for new funding opportunities and partnerships to resource our region with the best expertise and technologies possible. It is absolutely no exaggeration to say that 2010 was a turning point for HealthBridge as a company. We were awarded more than $25 million in multi-year federal contracts and agreements. Using our health information technology and process redesign expertise, we are now revamping the services and programs we're offering to keep up with the changing times and to help you do the same. Last year, we launched 4 new initiatives that will help us serve you and our community and our region better. Briefly, in June of 2010, we launched the Tri-State Regional Extension Center, the root of this meeting. In September, HealthBridge and 5 other organizations formed the Greater Cincinnati Beacon Collaboration through a $13.75 million federal cooperative agreement from the Department of Health and Human Services. We have also been using the nationwide health information network. HealthBridge became one of the first of a handful of organizations across the nation to successfully exchange data between the community and the federal agencies and other communities. And this is production data, not just test data. And finally, HealthBridge and the Greater Dayton Area Hospital Association formed a collaboration to launch the Greater Dayton Area Health Information Network. We'll provide you more detail about these initiatives throughout the day. But together, these new programs and the investments that are coming in are helping Greater Cincinnati and the tri-state region move to the next phase of how we think healthcare will be delivered across the country in the future. As Dr. David Blumenthal, the former national HIT coordinator, said many times, information is the lifeblood of medicine. Health information technology and exchange are its circulatory system. Our vision is to use widespread adoption of technology and secure connectivity to help deliver complete health information wherever and whenever it's needed for better patient care. Together, we stand at a tipping point, able to become one of the nation's first regions to truly achieve this connected, patient-centric vision of healthcare. That vision is in sight. It's on the horizon. This is a very exciting time to be in healthcare. I want to spend just a second to thank several of the organizations and folks that have helped us get to this point. We have been very fortunate at every stage of our development that our sponsoring organizations, our partners, have demonstrated real courage and leadership and innovative spirit, the willingness to take a chance that usually is required to get to real advancement. Last night, during a special leadership recognition dinner, we gave out 3 awards. The first, we call the Community Connector Award, was given to Mercy Health Partners, Jim May, Chief Executive Officer. The second, the Visionary Leadership Award, went to Cincinnati Children's Hospital Medical Center and was accepted by D. Ellingwood, Senior Vice President. And finally, the Innovation Champion Award went to TriHealth and was accepted by John Prout, their CEO. In addition to these individuals and organizations, we want to recognize some folks who've been great partners with us through almost 15 years and a number of different initiatives. First, and because they're my boss, if there's anybody that's on the HealthBridge board now or has been on the HealthBridge board, if you could just raise your hand so you could be recognized. We have a couple here. So. And we also want to recognize organizations that partnered with us in launching the Regional Extension Center and helping it succeed so well over the past year. And you'll hear a lot more about that during the day. Let's see, Rob Edwards and the team at the University of Kentucky. If you're here, if you just raise your hand so people can recognize you. Dr. Todd Rowland and Kathy Church of HealthLink in Bloomington, Indiana. Marty Larson of the Collaborative Communities HIE, and also working with the Dayton HIE now. Gary Ozanich of Northern Kentucky University. Dr. Betty Regan of Northeast Kentucky Regional Health Information Organization, and 2 companies, Healthcare Excel and the Ohio Shared Information Services, better known as OSIS. So a round of applause for all those folks for making that possible. And finally, we really want to recognize the organizations that helped us to launch the Greater Cincinnati Beacon Collaboration. They are the Health Improvement Collaborative. Greg, I know you're here. If you could raise your hand. Greg Ebels, the Executive Director of the Health Improvement Collaborative. Greater Cincinnati Health Council. I know Colleen O'Toole has a son graduating, so she couldn't be here. Also, Cincinnati Children's, University of Cincinnati, and GE. I know we have several folks from those organizations here. Those are the core of the Beacon collaboration, which you'll hear some more about. Anyway, thank you for being with us today. We trust that this conference will be a rich time of learning and stimulating interaction. And at this point, I'd like to ask David Groves, the Executive Director of the Tri-State Regional Extension Center, to come to the podium and kick off this morning's program. Thank you.